So I'm just getting ready to take off for the evening. I have to run home. So I'm just getting ready to take off this evening, and before I do so, I wanted to shoot this video because I thought it would complement the blog post that Mike Reinhold did on his site, which was discussing the importance of functional hip mobility, especially with hip flexion. So one of the approaches that I like to take in terms of improving hip flexion is to do a mobilization, which I've found to be incredibly effective, that involves having one of these jump stretch bands, and I just have this anchored to the wall using an H2 system, which the guys at Core Energy Fitness developed, and they've developed a whole slew of products for resistance band training, but they're out on the West Coast, so I want to throw a shout out to them. So to improve hip flexion mobility, this is essentially a mulligan technique, which involves mobilization with movement. And you can really get the patient doing this. Sometimes they need a little bit of assistance just to help stabilize them. But what I'm going to do is, I have this band anchored high up on my thigh. Alright? And I'm going to kneel on this cushion here. I'm going to have my feet positioned so the dorsum of the foot or the laces are pointed down. And I'm just going to rock back and forth into a quadruped position. Alright? And what this is doing is creating posterior glide at the level of the femur and where it interfaces with the pelvis. So I generally will work this anywhere from 90 seconds to 2 minutes. And you can really load this up, alright? So don't hesitate to be shy. And always remember to do pre and post testing. So if you're in the clinic, get a baseline goniometric measurement and then reassess after the technique to make sure that you're making gains. Alright, so give that a shot. I think that will be incredibly valuable as a mobilization technique for your patients, and ultimately is going to improve your patient outcomes. So, hope you enjoyed it.